Necessity is the mother of invention, the old adage goes. This because many years after the outbreak of HIV/AIDS in present-day Greater Masaka, there are recurrent challenges that still stick out like a sore thumb. For example, the HIV prevalence there, 8.1%, remains higher than the national figure at 5%. This is why Professor Fred Sewamala joined the struggle to try and find solutions to the most pressing needs like adherence to antiretroviral drugs through his organization, the International Center for Child Health and Development.
We have projects which are focused on schools, which are intended to keep young people in schools, which are intended to create economic strengthening among families or within families that these young people belong to. Because we know that one of the reasons young people drop out of school or they lose hope is because of poverty. So if you stabilize their families, then you are more likely to get these young people perform well in school, but also stay in school. So we have that line of programs and projects which are located in over 100 schools in the Greater Masaka region, which is about 7 different political districts. Then we have another line of projects which is focused on adherence to ART treatment. And these projects are focused on young people who are living with HIV and AIDS. The question is, how come, even if ARTs are free in Uganda, provided you can go to a medical professional and they find out that you have HIV, you can be put on medication right away. But the issue is most young people are not adhering to that medication. And what they tell us is that because they don't have either the resources to afford food, which is needed when someone is going to take that heavy medication. So we are trying to figure out, can we economically stabilize families of those young people and families of where these young people live, so that these young people can afford things like food. These young people can afford transport to the clinics and hospitals and healthcare centers to be able to access medication. These young people can be able to afford all the necessities around medication, which is free. So that's the other line. Then the other one is really studies and programs which are focused within communities, where we look at communities around what we call HIV hotspots. And in these hotspots, you have high prevalence rates of HIV, high incidences of HIV. So can we think about HIV risk reduction seminars, HIV risk reduction trainings? Can we think about women and young people who are involved in very risky businesses in these areas? And we are working in over 20 different centers, which we call HIV hotspots, both fishing villages, but also where the truck drivers park along the highway. So we are working those. In terms of clinics, we are in over 50 different healthcare centers, clinics or hospitals around the Greater Masaka region.
Professor Sewamala has for the last decade also helped develop cohorts of researchers with particular targets to resolving the problems at home.
For 10 years, we have reached over 70,000 people. 10 years, we have opened up new offices. We started small in Rakai. We are now in over 7 different districts. 10 years along the way, we have also moved from Masaka. We are now working in Bidibidi among the refugee community. We are now working in Arua among the urban refugees because they have similar issues. Probably theirs may even be more pronounced because they are living in a country which is simply a host country, but that's not their country. So then we also have another line of training, where we train a young cadre of researchers, including medical doctors, including public health practitioners, including social workers, including people who are interested in learning about research, teachers. And when we train them, we take them either to the US at Washington University, where we have trained over 30 participants, over 30 trainees from Uganda, or we bring the programs here in Uganda and we train those people who are interested in being researchers. But you must have either a PhD or you must be at the advanced level of doing your doctoral program, a PhD, or you must be a medical doctor having done that terminal degree.
He says the community is key for all the research projects.
Any community engaged research, any community engaged researcher, anyone involving the community, for as long as people have trust in your work, for as long as you engage them from the very beginning, that's always the best thing. So how has it been here? It has been excellent, and the only reason is that because I was trained from the word go, you have to engage the community. It would have been different if I had not engaged the community.
According to Professor Sewamala, more Ugandans have a platform to train for specialized professions through the various projects.
The next thing that I really want to do, and that's why I visited the Parliament of Uganda, is to get the evidence, to inform government about this evidence, and to figure out how can this become policy. We continue to build pipelines. When I said building pipelines, we recruit our staff from high school. We teach them about research. They go to the universities knowing that they have a position at ICHAD. So as they are at the university, they continue working with us as data collectors, as statistical analysts. When they finish, they are given a position at ICHAD.
Walter Mwesigye, NTV.